Great. So thank you, everybody. Welcome to 3 causes of leaky gut syndrome and how to fix it. This is going to be a very exciting webinar. I hope everyone's excited. So my name is Julianne McGrady. Normally I'm here with my colleague and friend Heather Pack, but she's a little under the weather this morning. I'm your integrative movement specialist, and just a quick brief. That means that I teach a very specific process of posture, exercise, and lifestyle changes, encompassing alignment, breathing, and control throughout your entire body during your specific exercises that results in increases in your range of motion, mobility, strength, stamina, and overall balance. So very excited to have Dr. Korman. We developed this Your Movement Solutions platform to educate, empower, and motivate individuals just like you this morning who are looking for a healthier and happier lifestyle. And we're very excited. You can reach out to us by emailing us at yourmovementsolutions@gmail.com. We welcome your feedback and any questions you may have. So Dr. Korman has been providing our webinars. She's one of the professionals we work with that we're very fortunate to work with. She's been a chiropractic physician in the area. Well, she's in Minnesota this morning, but looks beautiful there. But she's been in the Charlotte County area for over 30 years. She received a postdoctorate degree in nutrition from the American Clinical Board of Nutrition back in 2000, and remains one of only 300 doctors nationwide with this specialty. So her passion is working with menopausal women to eliminate fatigue, chronic pain, and unwanted belly fat through lifestyle and functional medicine so that they can reclaim their vitality and stay engaged in the active life that they love. Now, for any of you gentlemen that are joining us this morning, Dr. Korman does work with you guys too, but she does. Yes, so. So anyway, welcome Dr. Korman, and we're very excited about this webinar this morning, and take it away.
Thank you, Julianne. And yes, I am enjoying this Minnesota morning. It's 64 degrees right now. It was 58 when we woke up. So I'm enjoying a little bit of reprieve from Florida. And so wherever you're listening from, I want to put in the chat where you're listening from, especially if it's other than Port Charlotte, where I think most of the listeners are from. And glad to have you join us this morning. And I'm very passionate about sharing this information because it's well known that disease starts in the gut. And so when we improve our gut function, guess what we're improving? Overall health. So hi, sister, it's 59 degrees in Ventura, California. Yeah, so very, very nice. And so when we can improve, again, gut function, we are improving overall health. And that's why I'm excited to talk about this. Most Americans really have poor gut function. And we're going to talk about some of the symptoms of that and what that can lead to if we don't find a good root cause resolution to those illnesses. So before we get started with that, I want to share a time I'll never forget. It was a winter day in Minnesota, again, January, though, of 2000. And it was a cold day, although all winter days in Minnesota are cold days. That's why I moved away in 1987 after I graduated from chiropractic school. But I had forgotten how really bone-chilling a Minnesota winter can be. My grandfather had just passed away. And so I was visiting with my grandmother. If you hear the planes in the background, that's because I'm outside right now enjoying this weather. And I was spending some time with my grandmother and some family members. And after a few days, I had noticed that I had broken out in my thighs, had small little tiny red itchy patches on my thighs. And I said, oh no, don't tell me I'm allergic to chocolate. Because we had been overindulging in chocolate in the past 3 days because this was gifted to my grandmother, right? And how can life go on without chocolate? And so I had similar rashes on the backs of my hands on and off over the past several years, and had tried creams and lotions. I had tried eliminating certain foods with very little success. So I finally made a decision that I needed to test and not guess and find out what was going on. So I did some food sensitivity testing and found out I was sensitive to not only chocolate, but many other foods I commonly consumed. And so I said, well, I'm just going to discipline myself and get off these foods. So when I got off these foods, within 2 weeks, 90% of my skin lesions had disappeared. And the other 10% eventually went away too. But what I had found out was the biggest culprit that was actually causing a leaky gut, was what I found out, was gluten. And so it wasn't until I completely eliminated gluten, which was about 11 years ago, that my gut had healed, and I'm now able to enjoy almost all foods, including chocolate. Because who can live without their organic chocolate, with sea salt, And so, but it was this leaky gut situation that that had that had manifested in my body and was presenting with skin lesions for myself. And it wasn't until I got to the root cause of this that I was able to heal my gut and enjoy some foods. So let me share my screen here with you. There we are. So my passion and my purpose here. And so that is to help people find root cause resolution to chronic illness, instead of relying on maybe symptoms, just treating symptoms alone, which is typically what mainstream medical will do. So let me see if I can move to my next slide. I'm going to move this chat screen here, just 1 second. There we are. I'm going to move Julie here down. There we go. So again, if we think about symptoms as being the leaves on a tree, and we can treat, if those leaves start to discolor, we can treat those leaves, or we can look deeper into what's going on in the roots. And this is what I'm going to be talking about, is actually finding the root causes of disease, and one of them being a leaky gut. So today we're going to talk about exactly what is a leaky gut and what are the symptoms. We'll talk about the three main causes of leaky gut and how we diagnose it. And then lastly, we'll talk about how to fix it. Lifestyle nutritional strategies to repair the gut. So what is a leaky gut? If you look on the left side, you'll see that normally, this is actually, the gut is just a 1 cell layer thick organ, and protects us against outside pathogens. Those pathogens can be toxins, or are pathogens, bacteria, viruses. It could be foods. And so normally we have those nice tight junctions, and only small molecules and specific molecules are allowed to come into the body. But when we have a leaky gut, as you see on the right-hand side, those junctions are widened. And so we don't have the same control over what actually gets in our body and what stays out. So what are some of the common symptoms? I shared with you my skin issues, but we can also have some bloating, acid reflux, which are really common symptoms among Americans. Migraine headaches or other types of pain in body, food sensitivities, chronic fatigue, and brain fog. We also can have fibromyalgia or other systemic multiple joint pain. And then lastly, autoimmune conditions. So, and I want to kind of pay a little bit more attention to this particular one because autoimmune disease are increasing and I think very much underdiagnosed. And so in my particular case, what was going on with me is I was developing an autoimmune thyroid condition. And so a common denominator among people who have autoimmune diseases, and again, autoimmune, if you don't know, is auto is self, and your immune system is what protects you. And so an autoimmune condition is where your body is attacking its own self tissue, which is an overreactive immune system. And one common denominator amongst people with autoimmune conditions is a leaky gut. So about 15 years prior to that, I had a viral condition, and this precipitated in causing this leaky gut, which caused me to have some food sensitivities and led to this skin condition, which was actually an underlying autoimmune condition. And I have an autoimmune thyroid condition. And the reason why I'm going to talk just a little bit about this is because a lot of people have hypo or low functioning thyroid, and most of these thyroid conditions are actually an autoimmune thyroid, but it's never been diagnosed because many doctors do not run the antibody tests to find out if you have an autoimmune condition against your thyroid. So if you're one of those people and you have a low functioning thyroid, I would ask your doctors to run the antibody tests. It's a blood test to find out if you do in fact have an autoimmune thyroid condition. So what are some of the causes of a leaky gut? Well, the underlying cause of most of it is inflammation, and it starts with our diet. So sugar and processed carbohydrates are a big culprit to inflaming our gut. And gluten, as I discussed earlier, is a protein that is in most grains, or a lot of grains, I would say, especially wheat grains. And it's a very inflammatory protein and can cause the leaky gut picture that we showed you earlier. Genetically modified grains are modified to withstand a poison called glyphosate or Roundup. And these grains have been modified and can be cause damage in our guts. These genetically modified grains include soybean and corn primarily. So we'll talk about how to eliminate those in a little bit. Vegetable oils are oftentimes made from soybean and corn as well. So they can not only be genetically modified, but they're rich in omega-6 oils, which are inflammatory. So a lot of our dressings and mayonnaise are made from vegetable oils, and they want to be eliminated. Food sensitivities, like I described, inflame the gut and can increase the leaky gut situation. And nightshade vegetables. Many people are sensitive to nightshade vegetables. And those include potatoes and tomatoes, cucumbers, eggplant, and bell peppers. Those are the vegetables with some of those small little seeds in there. And we'll talk about how you can minimize your sensitivity to nightshades as well. Medication. So many of the medications we take very frequently can contribute to leaky gut as well. Many Americans, I think we overuse antibiotics and too quickly. And what antibiotics do is they destroy the healthy bacteria in our gut. So yes, it gets rid of the bacteria perhaps it's trying to kill, but it also kills the friendly bacteria as well. So we really want to minimize the use of those as much as possible. Many Americans will rely on Tums and Prilosec and omeprazole. These are taken to oftentimes deal with a heartburn or bloating acid reflux, and these medications can really work against proper digestion. So our stomachs need a high acid content in order to digest carbohydrates, fats, and proteins. And they also signal the pancreas and the gallbladder to help with digestion as well. So if we block that system for a prolonged period of time, we can not only cause nutrient deficiencies, but also it can interfere with the healthy bacteria in our gut as well. Aspirins and ibuprofen obviously are very, very hard on the gastrointestinal tract and can cause bleeding as well. So some of the toxins I mentioned, glyphosate. So this is found, actually was found in Agent Orange, which we know how toxic that was. It's a neurotoxin. And we still find it in Roundup, which is very, very commonly used on our grasses to kill weeds, and genetically modified crops that I just had mentioned. And glyphosate is also used to improve the production of our wheat right now in the United States. So they will use glyphosate to kill the wheat crop early enough so they can have a second harvest. And so these toxins are sprayed on our crops, and then we ingest these, and they're very toxic to our system, not only our gut, but our brain as well. So some infections that can contribute to leaky gut. H. pylori is a common bacteria that produces ulcers. And ironically, H. pylori thrives in a low acidic environment. So many times people that have H. pylori or ulcers actually don't have enough acid production in their stomachs. And when they grab for Tums and the omeprazoles, they are actually decreasing acid and can cause the proliferation of this bacteria. And so one of the things we can do is to maintain a healthy acid environment to decrease the proliferation of this H. pylori bacteria. Candida is a yeast or fungus, which is very common, again, today with people that overtake antibiotics or have a diet high in sugars and processed carbohydrates. It thrives in that kind of an environment. And then Epstein-Barr, again, was the virus that causes mono that I had when I was about 20 years old. And I think was one of the precipitating factors to my leaky gut, as well as my autoimmune thyroid condition that I later developed. So what are some of the functional tests? How do we diagnose a leaky gut? And so a lot of doctors can maybe even deny that this process takes place because it's not typically found in typical blood testing, although there are some indications of inflammation and maybe autoimmune issues going on just through traditional blood tests. You can look at a C-reactive protein, which is an inflammatory marker. If that's elevated, we're looking at elevation of these inflammatory cytokines that can cause damage to the gut. So until we find out what's the reason for this inflammation, we can be developing a leaky gut that needs to be investigated. We can also have a lower high white blood cell count, which can indicate either an acute infection or maybe even more so a chronic low-grade infection. The eosinophils is another type of white blood cell which I see can be elevated in people who may have food sensitivity. So there's some of these ways we can look at traditional blood tests and see that there might be an indication of inflammation, leaky gut, and maybe an autoimmune disease going on. Food sensitivities are another test that we can look at, which can indicate a leaky gut. Now, sensitivity is going to be different than an allergy. A lot of people say, well, I've been tested for food allergies. It's different than a sensitivity. A food allergy will be almost an immediate reaction. You consume a strawberry, for example, and your lips swell up or your throat swells up, and the symptoms are very, very quick, within hours of consuming a food. A food sensitivity is much harder to diagnose because it's a delayed immune response. So you eat a food today, you know, whether it's gluten or it's corn, and you might develop skin rashes or a migraine or joint pain, joint stiffness, 24 or even 48 hours after consuming this food. So can be very difficult if you're just trying to guess what foods are involved. And many times people develop sensitivities to food that they never had before. Because again, once that gut is leaky, we can start to develop more sensitivities to food that we commonly consume. The lactulose and mannitol is another test which we look at. These are sugar molecules. One is a large molecule and one is a small molecule. So we can look at how tight the junctions are in the gut and what kind of size particles the body's allowing into the blood system. So we can do a ratio of those two molecules and find out if the gut is leaky, or permeable is another way to describe it. The OAT test is short for organic acid testing. That's a urinary test that can look at toxicity levels. So if someone is having some issues with glyphosate or other toxins, maybe even they have a genetic inability to detoxify these chemicals in their environment, we can see that with this organic acid testing. So there are several tests that you can see here that are functional tests, not typically run, but can be really beneficial in finding root causes to a leaky gut. So what are some lifestyle strategies that we can implement now, today, to help improve gut function, to help improve these tight junctions, and help avoid illness? We can eliminate sugar and processed foods. And I know some people find that difficult, especially right now. When people are under stress, they tend to gravitate towards their comfort foods, right? And sugar and fast food is the worst thing that we can do right now. So especially when we're at a high alert and high stress, we need to really make sure that we eat well and take really good care, self-care, right? We can try to modify an elimination diet where we can eliminate the 4 most common offenders to a leaky gut, and that is going to be gluten, dairy, soy, and egg. Those are the 4 biggest. Gluten by far is the biggest. Dairy would be a close second. So even just eliminating those 2, usually within 2 or 3 weeks, you will notice a difference. So you could try starting with the modified elimination diet. You want to avoid those genetically modified foods. Again, that is anything with corn, soybean in it, and a lot of sugar cane out there too as well. So looking for organic foods, if you are going to consume these foods, make sure they're organic so you can avoid the genetically modified organisms and food. So we want to balance our omega-6 and omega-3 ratios. So again, we were talking about the vegetable oils being high in omega-6. Well, your fish oils are going to be high in omega-3s. And I know there's a lot of toxins in our waters right now, so we want to be careful what choices we make for fish. But we want to consume more omega-3 fats. So if you're not going to be consuming a lot of fish, you may want to consider a supplement with omega-3 oils in them, especially from fish, smaller fish, like anchovies, mackerel, and sardines, smaller fish. So the larger fish, what happens is they can accumulate toxins, especially mercury. And so we want to stay away from larger fish. Smaller fish have not had a time to accumulate these toxins and heavy metals. We want to optimize vitamin D especially, and vitamin D is probably deficient in 70% of Americans, and even those of us that live in Florida. I find that a lot of people with a leaky gut and with autoimmune diseases also have a vitamin D deficiency, which I found was true for myself as well. And we want to get that vitamin D at a nice level in the serum. So a normal blood level for vitamin D is between 30 and 100 nanograms per milliliter. But what I recommend, especially for people trying to optimize their immune system, and if they have an autoimmune condition, is to get that level between 60 and 80 nanograms per milliliter. So I recommend everybody get their vitamin D tested and get those levels optimized in even now to protect your immune system and keep your immune system strong. If we do have some underlying infections, we do want to address those. A lot of infections can be treated just by supporting a healthy lifestyle. And under the rare occasions where we might need to take an antibiotic or other medical approaches, we can do that as well. Treat the infection and then start supporting a healthy gut with proper nutrition. Gut healing foods and supplements. So one really good gut healing food is bone broth. And we have gotten away from using bones to cook soups with. If you ask your mother, your grandmother, your grandparents, they almost always cook with bones. And we've kind of gotten away from that. And there's very healthy collagen in bones and cartilage of animals that actually help heal our gut. So bone broth is one of my favorite healing foods. And supplements, including probiotics, are very, very beneficial in promoting the healthy bacteria in our gut. We can also consume naturally fermented foods like sauerkraut and kimchi, which is fermented vegetables, and kombucha, which is actually fermented tea. You want to be careful when purchasing. Most grocery sauerkraut is really not really fermented. It's made with vinegar to have a fermented like taste, but naturally fermented sauerkraut will just have cabbage and sea salt. And then this ferments, and this healthy bacteria you can consume and is very, very, very beneficial for the proper gut bacteria and helping your immune system. So when we heal our gut, we heal our body. And we not only heal our body, we can heal our brain and heal our immune system as well. So before I get to the questions, I want you to, if you would, enter into the chat box what your favorite takeaway was today. I hope you learned some things. And before I get to the questions and answer, I want to share one more thing that I'm really, really excited about. And that is I have a new online course that I'm ready to launch. And it's my Geared to Be Well Menopausal Metabolic Reset Program. This is something I've been working on for about 5 years. And this is a 5-week online lifestyle program to eliminate chronic pain, fatigue, and unwanted belly fat that's been holding you back from living the vibrant, energetic life you love. And so for all of you that are on today, I will be sending you some information more about this. I'm going to be holding a webinar next month, and I will let you know all about the details of that in an upcoming email.